Good afternoon to everyone who joined with us from a different corner of the world. And I'm Dr. Tanvir, Associate Professor, College of Business Administration, IUBAT. So I will be acting as a moderator. So this webinar will be chaired by Professor Khair Jahan Sogra, Dean of College of Business Administration, International University of Business, Agriculture and Technology, Dhaka. So and the program will be I will let you know who already joined and who didn't join. So Professor Jahan Sogra, just can you come up with few words before I start, please? Thank you.
Hello, faculty members all around the world. I welcome you all. And the thing is, actually, I am feeling very honored and privileged to have an opportunity to join this webinar on research titled Prevalence and Factors Associated with Mental Health Impact of COVID-19 Pandemic in Bangladesh. I'll say that this timely research has been conducted by Dr. Tanvir Abid, Associate Professor of IUBAT, Dhaka, and his associates all around the world. All of you, from my side, I congratulate you to research or investigate a very timely issues which is affecting from all aspects all over the world, everybody's life in different way. So actually it is also affecting our mental health, because most of us for last 1.5 years almost, we are staying or working from home, and that has a tremendous creates a tremendous mental stress on not only our individuals, but who are inside the house living with him or her. So actually it is affecting the whole family, affecting the society, and affecting the nation as well. So I think this research is just only a beginning, and I must congratulate all the researchers to select such a timely topic, because actually we always think about our employees from if they come to the office, if they can perform, we reward them, or if they cannot perform, we punish them in a different way, but we never think of their mental well-being. So this research, I actually throw some light on a new issue, which not only will affect the Bangladeshi, will be effective for Bangladeshi managers or Bangladeshi people or Bangladeshi population or employees, but also all around the world. The thing is, I'm very much interested to hear from them, and I hope I will really learn something from them, which I can really apply in my own life and in my workplace. So please go ahead, Dr. Tanvir. If you can start, and I will take leave from now here. Okay, thank you all, and thanks for the joining, and especially those critics, those physicians who are researcher as well as professor in different universities, Dr. Hilal and Dr. Rosanna Kazins, all of you. Bye.
Thank you, Professor Dr. Khair Jahan Sogra, Dean of College of Business Administration, International University of Business, Agriculture and Technology, Dhaka. I'm giving the names who worked as the contributors for this research paper, which already been published. So Professor Dr. Major Nazmul Hasan Kolimullah, BNCCO, Vice Chancellor Begum Rokeya University, Rangpur, Dr. Uchichua Levi Osugua, Postdoctoral Research Fellow, School of Medicine, Western Sydney University, Australia, Taha Hussain, Lecturer, Department of Gender and Development Studies, Begum Rokeya University, Rangpur, Dr. Puana Christopher Gosson, he's an associate professor, Department of Psychiatry, College of Health Sciences, University of Jos, Nigeria. Mr. Paulus Bosak, PhD scholar, School of Environment and Life Sciences, University of Newcastle, Australia. Mr. Adnan Rahman, Senior Lecturer, College of Business Administration, IUBAT. Dr. Abdullah Al-Mamoon, Associate Professor, Faculty of Business and Management, UCSI University, Malaysia. Dr. P. Yuktamarani Rupan, sorry for my pronunciation if I'm wrong. So lecturer, Faculty of Entrepreneurship and Business, University Malaysia, Kelantan, Malaysia. Mr. Yusuf Hossain Khan, BATHM, he's an assistant professor, IUBAT. Dr. Abul Hassan Milton, Director, Research International, Dhaka, and Epidemiology Research Center, NSW, Australia, and Dhaka. And the last one, Dr. Kingsley Ego, Associate Professor, School of Health Sciences, Western Sydney University, Australia. And in today's webinar, we got two special guests. We are really honored and humbled. Mr. Dr. Helaluddin Ahmed, he's an associate professor, National Institute of Mental Health, Dhaka, and Dr. Rosanna Cousins, assistant head and associate professor of health psychology, Liverpool Hope University, Liverpool, UK. So our special guests, they will listen our presentation presented by Dewan Muhammad Nuri Yazdani, and they will give a sort of critique or suggestions. So how could we improve, in coming days for other researchers? So, Mr. Dewan, would you like to come up with your presentation for us? Thank you.
Yes, sir. Thank you very much, sir. Thanks a lot for giving me the opportunity to present the paper that we already have published in a journal, the Annals of Global Health. I'm going to present my presentation through the PowerPoint. Just give me a second. I'm just going to share the screen. So thanks once again, everyone, and good afternoon to everyone. The paper that we published was titled as The Prevalence and Factors Associated with Mental Health Impact of COVID-19 Pandemic in Bangladesh. So before going to discuss about the paper, let us go a bit on about the situation that is happening all around us. We know that, like, if we look at around the world, we know that in different kind of uncertain situation, people do become worried about the uncertainty that could caused by that. So people have the fear. The same kind of fear and worriness actually happen when we've been faced with these current pandemic known as the COVID-19. It's because not only about the uncertainty, it's about some other changes. The contingencies, the changes in our daily life, the movements becomes more restricted, new realities, working from home. Many of us are working from home. Then there was problem with employment. Students started their schooling from home, whether it is primary, secondary, or tertiary. Physical contacts we missed because of the contagions and other kind of factors between the family members, friends, and colleagues. And all of these factors actually imposed a huge burden on us, which reflects some sort of mental health issues. So this is what is happening not only in Bangladesh, it is happening all around us. Based on this common phenomena, we actually try to conduct research, which we did on last year when the lockdown was imposed by the government during April of last year. And if you look at the names, which Dr.Tanvir already have mentioned, these are the researchers who actually worked to find out the impact of COVID-19 on the mental health level in Bangladesh. About the basic introduction, what we have seen or what we have found out. Yep, we know that COVID-19 have caused havoc, and we have to adjust to our personal lifestyle. And we faced greater challenges due to the fragile health system. And as all of us know, the population of Bangladesh is highly dense. There were fear, obviously there were fear. There were panic. And these fear and panic were more spreaded by the traditional media, news media, and the social media. Many misconceptions about these particular disease or particular pandemic has been spread out. And there was basically containment measures imposed by the government, which also could cause some sort of mental impact. The COVID-19 also had negative impact on mental health because people become uncertain about their future, uncertain about the effective treatment during the time when our research was conducted. Availability of effective vaccines here. At that time, vaccination was not available. Whether life will go back to normal, when it will come back to normal, we don't know. At that time, we didn't know. Healthcare delivery in Bangladesh also had challenges, all part of this country. And it actually had the impact on the mental health of the greater population in Bangladesh. So we made an aim to do this study, which was to determine the prevalence of mental health symptoms during the pandemic and to identify the basic factors associated with the mental health symptoms on the general population of Bangladesh. So we made the introduction. Now, Based on the introduction, obviously there were some objectives. The basic objective already I have said, to identify the factors associated with the mental health impact caused by COVID-19 pandemic in Bangladesh. What about the specific ones? The broad ones, specific ones, if you look at mental health issue, is been covered by three individual factors known as anxiety, depression, and stress. So we were to find out, to examine the prevalence and factors associated with these three individual identifiers. So these were all about our objectives. So we met the objectives. What about the methods? We look at the methods, we did the study design. And we know in Bangladesh, the whole country has been divided into 8 divisions. We did a cross-sectional study, online study obviously. And as I have mentioned before, it was done in April, between the 1st of April to the 30th April last year, when the mandatory lockdown was imposed by the government in different parts of the country. Now, on the design, what about the sampling? To do for the sampling, we did, first of all, made an online survey through the social medias platforms. For example, like Facebook, Google+, LinkedIn, and Twitter. As we know, because of these disease, we could not make, and especially we cannot make right at this moment even the traditional face-to-face interview. It was impossible. And for the sampling, yep, we did the snowball sampling. And we also thought about the eligibility of the participants. What about the eligibility? We find out there must be, we fixed out there must be the residents of this country. They must be able to provide the online informed consent, and they had to be 18 years and above. After the sampling, we look at the measurements. We thought of dividing the survey into 5 parts. The first part was basically looking at the demographic of the respondents of Bangladesh. Second part was all about the household factors, about the living arrangements. How many people are living in together, whether they are living with a family, what about the number of family members. Then again on the third part, we looked at whether people been tested for COVID-19 or not. After that, we looked for the fourth part, which was to see about the World Health Organization's recommended precautionary measures, whether people complied with those or not. And on the very last part, the fifth one, we actually evaluated the history of the health-related symptoms of the respondents, like fever, pain, headache, chills, dizziness, and so on. We also have used an internationally recognized scale, a health issue related scale or mental health related scale called DASS-21 to identify the depression, anxiety, and stress. So with the help of these tools and about the design of the measurements, we started the statistical analysis. Go for the statistical analysis. As we have mentioned, the demographics, so descriptive statistics came on in the very beginning. We also looked for the prevalence and 95% confidence intervals for that normal, mild, moderate, and severe levels of the same issue called depression, anxiety, and stress. These association was further tested by the odds ratio. Used a univariate and multiple multinomial logistic regression analysis. We also developed 4-stage modeling. First stage, the demographic factors were entered into the model. Obviously, we looked at some other factors, the household factors. We looked at the other factors called the public health and the health condition factors, the lockdown factors, education. All of these things actually being used while we have done the statistical analysis with the modeling of. After that, we also have looked at a different one called spatial analysis. Spatial analysis was basically done through the map comparisons and regression analysis for that things that I have already mentioned, called mild, moderate, and severe levels of mental health. When I will show the map, you will easily find out that how we have used it to locate the divisions where these particular depression, anxiety, and stress has been. If you look at this is the demographic table. The study population, you could see that it was a huge one, the sample. It was 10,609. As usual, we use the different variables like the demographics, where we used for the division, gender, education, age, marital status, working status. Then we looked at the household factors, as I have mentioned before, how people are living, the living arrangements, household size. We also looked at whether people being tested for COVID-19 or not, whether people looked with the compliances with the public health measures, whether people help others to know about the things. We also looked at the protective measures, whether they have taken it inside of their home to protect their family and themselves. And obviously, the very important thing, the health conditions during that time, which I mentioned about the fever, chills, and so on. So these are the data that we have found out after the descriptive has been done, which you can see from here, which has been shown, the demographic in here has been shown with the numbers and percentage. You could easily see in here that males were dominated. The age between 18 to 37, 79.4% was there. You see the level of education, which is university degree or higher. And obviously 50.3% people were married. We find out about the living arrangement. 80.4% people were living with family, with 3 or more people, and were involved in the full-time or part-time job. We also find out how many people been tested with COVID-19 and confirmed cases of COVID-19, and how many were been suspected. Then obviously the other things, the quarantine, then like whether people being complied with the public health measures, which has been shown in here with the data and the percentage, and about the symptoms of COVID-19, which is related to COVID-19, I would rather say. The data collection, which is been with the fever and cough, 91.7% we have found out people being infected with that. And about the breathing, it was 86.8% people. So these were the more important characteristics when we did the demographic ones. When we find out the demographic characteristics of the people, we find out that these were the dominating things find out from our study. Except to that, we also wanted to look at, as I have mentioned already, the depression, anxiety, and stress. What about those? What about the multivariable analysis? What are the variables? What about the special analysis that we have done? We have find out when we looked about the very first one for the depression, we find out, being married, education level, about the accommodation, which part of the country they're living, especially which division of the country they're living, experience of COVID-19 related to health issues or symptoms, these were being done. When I'll show the special analysis, the map presentation, you'll see in here that especially Rangpur, Sylhet, Chittagong, which has been marked with the darkest brown color, you'll see that the severe level of depression is there. Let's go to that particular one. So this is the severe level one. On the very left-hand side, down one, you'll see Rangpur, Sylhet, and Chittagong, where the depression was severe when we had our research or study. After the depression, when we look at the symptoms related to anxiety, we find out that, females become one of the most important variable in here, who were divorced or widowed. And accommodation related to them, shared accommodation, lockdown, quarantine, fever, when the data were collected, these were become more important. And obviously, one of the very important things that we find out in here was about the older participants experienced a lower risk of anxiety at all levels. It was from our descriptive statistics also. It's because the young generation, they have been impacted most, as they were the future generation, future workforce. They're uncertain where they're going to, what is going to happen to them. And again, on the spatial analysis, we find out that Chittagong, Mymensingh, Rangpur, the mostly been severely anxious people during that particular lockdown. Let's go to that particular slide. So again, on the very left-hand side, Rangpur, Mymensingh, Chittagong being impacted the most by the anxiety, the severe level of anxiety during that time period. So depression, we have seen, obviously, we have seen the other forms. Now, what about the stress? Same in here, females, education, postgraduate education, older than 27 years, married, having symptoms of fever, quarantines, they've been impacted most and have the experience of most symptoms of stress at all levels. And again, with the spatial analysis or with the our map analysis, you'll see that Dhaka, Rangpur, and Sylhet experience a severe level of stress. Let us see whether it is there or not. Yes, Rangpur, Sylhet, and Chittagong on the very left-hand side, the downside. the severe level of stress. We find out on these three particular divisions among the 8 divisions of the country, they had that. So it's been found out by having these 3 individual identifications where people are having more been impacted by these mental health conditions. Now we have done the analysis, we have seen where the things are going on. Now, if we look at the outcome from our study, from our research, we can easily find out what is in there. Yeah, we used obviously the internationally recognized scale, DSS-21, to identify the prevalence of the mental health symptoms, obviously during the lockdown period. And we find out the depression, anxiety, and stress level is present. And in here, we've also been find out that these mental health conditions been mostly impacted to the females. Married, they have various factors related to accommodation, living arrangement. Obviously, they had to travel via the public transport. We have a question on that on our questionnaire. And people who practice self-quarantine, high prevalence of depression, anxiety, and stress was there. We can find out, we can easily see from our data that our sample size was quite large. It was 10,609 in particular. And from that sample size, as we have seen, female being impacted most by this COVID-19 in the mental health section. It is obvious because they are being employed in some of the most important sectors in the country called retail, manufacturing, healthcare, and service, where the current pandemic has hit a lot. And the females, is they are not only just working in outside, they have to take care of their family. So automatically, they did have that kind of mental pressure to look at the family, to balance with the work and all kinds of stuff. And we find out the education, we find out the age, we find out that it was worse mental condition among in the high level of educated people, the educated adolescents, I would rather say in here, living in the urban Dhaka area, as they are the most, as I have mentioned before, that the most important group of people in this country for the concentration onto the future workforce. They will become the future workforce very soon. So they had that problem in there. They had that mental health issues over there. Misconceptions was there. Self-quarantine, isolation measures were there. Yeah, we know that it's been there. But the news is spreaded with several kind of, it caused some problem. It had that psychological issues. It caused that mental issues, mental pressure onto the people living in this part of the country. So when we look at all of these things, it is easily been find out that irrespective of the different divisions, irrespective of the different kind of variables that we have used to, there was a big impact of mental health issues among the people, whether we looked at the depression, whether we looked at the stress or any other issues we do come in here. So on the basis of each and everything, if we want to conclude the things, conclude our report, we are obvious. There was symptoms of depression, anxiety, and stress among the people. The females, males, they were being dominated by those kind of mental health issues. What about the people of less education? What about the people tested for COVID-19 positive? Obviously, they do have more of the mental health issues. They obviously do have, because they are uncertain. And as we know, in Bangladesh, it is quite impossible for the people who are living far away from the major city called Dhaka or some other big division, like the big cities around the country, to directly contact with the health professionals, to other professionals. So what can we do? We can use a very powerful medium right at this moment called the internet. We can use the video calls. We can use this particular technology to reach them, to let them know that yes, COVID-19 is dangerous. We know that. We understand it. It could cause some severity among us, but let's not go outside. Let's not avoid the precautions being given by World Health Organization or the government. Then the mental health problem could be minimized a level. So the thing is, it's not only impacting on the mental health. It could, the COVID-19 could have an impact on the psychological issues. would have an impact on definitely on the business level, the, the education level. Students are also suffering a lot. So we are basically been looking into it also in our future research. This is the reference list that I have used on the slides on the basis of where I got the information. And with these particular reference slide, I hereby want to conclude my presentation on the paper. Thank you very much, everyone.
Thank you, Dewan. And based on his presentation, I would like to open a discussion for us. So I would like to ask Dr. Uchichua Levy Osogua. Actually, I of course I must say he contributed a lot and he worked really hard for this paper. So Mr. Levy, would you please come up with few words? The research we done, I mean, in a body. Do you have anything to say, please?
Yeah, thanks. So thank you, Tanvir and your team. It's a very good way of disseminating this important information. I think the research was timely based on what was happening around the globe then. Within the same time, there has been several calls on the mental health of children. So that was an area that we couldn't capture because children actually faced most of this more than the parents do. They were at home, had no peers to play with, schools were closed, they were on the screen time almost every time, spent more hours at home, being scolded by parents all the time for what they were not doing. And you could imagine what these young people will go through. And from that perspective, I think that's a very vulnerable population that we didn't capture. Not really our fault, but it was the design of the study. It was an online survey. It was only sent out to people who could access that. And some kids wouldn't have completed it without their parents. So there were a lot of limitations why we wouldn't. I think that's the area of research that we should look into now as well. When parents face this mental health issue, it falls back on the kids. Children face it as well. They become the blame and they tend to take blame for what is not their fault. So I would think the impact of this mental health goes beyond the pandemic. What we don't know is how huge it's going to be when the pandemic is gone. For countries like ours, Africa, we had similar findings in our research as well. We don't know how to cope with that. We don't have mental health resources. We don't have the expertise to do that. So when the pandemic is done, we'll be left with a chunk of difficulties that the healthcare system cannot cope with. So that's where the whole downturn we done on everyone. I think the earlier we start letting people know the impact this is, the easier it is for us to cope with this when pandemic is gone. I would also recommend this kind of presentation for a community, not just the experts like us, not just the academicians. Taking this to the community halls, talking to people about what this pandemic is going to do, so they are aware of what the effect is on their mental health. Families should be involved. They should talk about this on their own, have the kids speak out, find out what issues they're facing. It will help, so we as academicians will have our own side, but the community is also there and we should reach out to them through such platforms like this. And thanks to Dewan for what you said. Online might not be easier. We might just have people organize Zoom conferences with families, communities, do it at your own time. This will be impactful as well. So we can as well raise the awareness about this very big pandemic that is looming besides the pandemic that we're into now. So I think that was great. And thanks for organizing that and for having me. It's a pleasure.
Thank you, Dr. Levy. Now I would like to ask Mr. Polas Bosak. Actually, he did the special analysis for this paper. So actually, and he did a good job. So Mr. Polas Bosak, come up with a few words for this paper.
All right, thank you. First of all, I would say that the topic of this research was, of course, a timely one and an interesting one, where in which we were just thinking about, how the COVID caused mental stress and anxiety and other difficulties to people. But from the methodological perspective, I would say that I think one of the strength of this paper, of course, is to look at the spatial dimension of it. When I started, doing some informal and other research or readings around COVID-19 last year, my thinking was that the urban population would be mostly affected with this COVID situation. But our research or our findings suggest that it's not always the case. And when we segregated the data and we looked at the different division and separately, that's why we could reveal some of those dimensions. And I think, because of this, there might be other research or future research which could try to find out why we are seeing this kind of pattern. Um, I mean, I think our data shows that yes, that is happening, but I think that further research should be done regarding why this kind of pattern is coming up. So with that, I would thank you, all of my colleagues who contributed, and thanks to Tanvir Bhai as well for giving me the opportunity to be part of this research, and hopefully we'll do other research uh, in this fashion. So thank you.
Thank you, Mr. Paulos Boschak, a PhD scholar from School of Environmental Life Sciences, University of Newcastle, Australia. I would like to request Piwana Christopher Goshen, Associate Professor, Department of Psychiatry, College of Health Science, University of Jos, Nigeria. Chris, I got a question to ask you. What is happening in Nigeria, and how do you relate to the findings as we got, from our research, where you are part of this publication?
Good afternoon. Good day to everyone. I also want to thank everyone who made it possible for us to deliver on this paper. I also appreciate those who are here to look at our work to see if there are areas of improvement. Bangladesh and Nigeria, in my view, we seem to have a few similarities. We have close family system. The extended family is not broken completely. It still exists, and I think it has continued to serve as a buffer for most of what would have been a disaster regarding the mental health of people in both societies, Bangladesh and Nigeria. Here, from our study, the one we're reviewing today, you would notice that a lot of people who were affected, people who are down the line in the business chain, who maybe suppliers or who need to provide menial labor at factories, because the pandemic affected the entire business system worldwide, but particularly the clothing and the clothing business in Bangladesh. A lot of those people lower in the ladder were adversely affected with the anxiety, depression, because their daily sources of income were not forthcoming. It's the same thing in Nigeria. During the restrictive orders by government, where shops were closed, people couldn't go out, especially those who rely on daily pay. They couldn't go out because of the restrictions. That reduced their financial strength. And with that, the stress of caring for their families and sustaining the family, within this period. So the similarity between Bangladesh and Nigeria in terms of those in the lower rung of the society is the fact that most of them couldn't continue with their means of livelihood because of the restrictions that governments had placed due to the pandemic. And because of that, most of them went through a lot of difficulties, and it was manifested, for instance, in this study by the prevalence of anxiety and depressive symptoms that they presented with. Here in Nigeria, in the teaching hospital where I worked, most of the cases that we saw during the pandemic, during the lockdown, were cases of alcohol withdrawal, where patients, developed withdrawal symptoms and had to be admitted. And you can understand that because most liquor shops were closed. And so people who were already dependent on these substances couldn't get access to it. And as a result of that, they came down with withdrawal symptoms, both male and female. But I think we saw more male presenting to us in the hospital, and they were also admitted. We also had issues with people, elderly people in Nigeria during the lockdown. The science shows that those who are over 60 at the onset of the pandemic, those who are over 60 were, most at risk, especially those of them who had comorbid medical conditions, And so for us in the hospital, most of our older patients who had dementia, had memory deficits, people who are long-standing psychiatric patients, they couldn't come to hospital because of the lockdown. And so they ran out of their drugs. Pharmacy shops where they could buy the drugs were not available for them to get their medications. So we had a lot of worsening of their symptoms when they finally got to the hospital at the time the lockdown was lifted. We also had patients who, became worse clinically, not just because of their symptoms or the diagnosis they had, but most of these elderly people, they looked forward to coming to town from rural areas, coming to town where their children live, to come for clinic, their follow-up, and then spend a day or two with their grandchildren before returning back to the villages. As a result of the lockdown, that was also denied them. So while they had problems seeing their doctors, they also had problem interacting with their children and grandchildren. So that was extremely, extremely stressful and difficult for them. Lastly, I don't know about Bangladesh, but in Nigeria, telepsychiatry is almost rudimentary. Most elderly people cannot use these Android phones, and so they can't have access to medical advice, maybe call their doctors to say, look, I've run out of medications, what do I do, to talk with their doctors. That was also not available. And most of our hospitals are not especially public hospitals, are not providing internet services in terms of providing care for their patients. And so we hope that going forward, now that the pandemic has refused to leave us, maybe those are the areas of research one could look at and see the extent to which lack of the internet services, particularly for elderly patients, how it's affecting their health and what we can do about it.
Thank you, Chris. Now I'd like to ask Dr. Dr. Yokta Parani Parmurapan, lecturer, Faculty of Entrepreneurship and Business. Dr. Yokta, how do you feel? From your country's point of view, I think it's a lockdown is going on over there. So based on the paper presented, so how do you relate your country's condition, especially in the area of mental health?
All right, good. It's literally evening here in Malaysia. Okay, yeah, Malaysia is having quite a tough time now. We are having our third wave actually. So for the population rate, it's quite bad. And currently, we have been imposed MCO from tomorrow for the next 4 weeks to the entire Malaysia. Literally no district travel, no state travel, no Raya celebration. So things seems to be a little bit chaotic. And this has caused, obviously mental health is literally taking a toll on Malaysians as well. There has been high suicide rates among Malaysians, especially we can see a clear demarcation among the good earning people, which means the pilots and people of that category. We have been seeing quite a lot of suicide cases in Malaysia. So I think we are trying to handle this mental health awareness, the importance. There's a lot of new upcoming lines, toll free lines to call and speak up, So I think the study is apt to the scenario, but then again, with the economy is also taking a toll, people losing their jobs. That is also something that Malaysia is looking at this point of time because of COVID.
Okay, thank you, Yokta. Thank you, Yokta. Now I'm just going for a very short. Mr. Yusuf Hussain Khan, just do you have anything to say? Just a little bit shorter, please, based on the findings.
Dr. Tanvir, I'd like to thank you and thank all the other contributors to this paper. Special thanks to you for inviting me to contribute in this paper. I was very surprised when you asked me because I'm from a very different field. I do my research in tourism, but when you told me to join in a team, I thought it's not too difficult, too different from the mental health on people and mental health on tourists. So I thought, okay, let's see how it works. So I'm not going to discuss about what we found already on the research because most of you already talked. But I think the future research will be very, very interesting on this area because the data we have collected, it was last year on April when the pandemic has just begun in our country. So now the pandemic is on our head for more than a year. So I think this is going to be interesting because when we took the data from our respondent, they have just felt how the pandemic is. But now it's been more than a year. Maybe most of the people that are under finance, they have more depression, they have more stress. Also, the health systems, the respondent from the medical services. So I think a future research, I mean, we don't need to change the pattern. We can keep the same pattern, we can keep the same methodology and see how the effect of the pandemic on the mental health and stress after the pandemic is on our head for more than a year. Thank you very much.
Okay, thank you. Thank you, Mr. Yusuf. I want to take some suggestion or the critic from Dr. Rosanna Cousins, Associate Professor of Health Psychology at Liverpool Hope University, Liverpool, UK. Dr. Rosanna, so based on the findings presented in terms of Bangladesh, I mean, in terms of mental health in Bangladesh, so what is your view and how do you look at those findings?
Yeah, it's really interesting and thank you so much for including me in this discussion. As you probably realise, I live in what's called a more affluent place. But we've still been subject to horrendous death rates from COVID and lockdown and all those other things, even though we seem to be turning the corner more. One thing that's come through to me as I've been listening to this, and it's whilst losing your job or being furloughed or not being able to earn money, I mean, in England, it's been slightly easier because we've had this furlough system where people who were locked down and couldn't work to try and stop the businesses going under, they've been paid 80%. I mean, we're still waiting for the taxes rising enormously to pay for this in due course, but it has been slightly level. But one thing I think that's come through all this is impact on social life, is what I would call it. Impact on social life, not being able to go out, be with families. It doesn't matter. That seems to be the most important thing that we need to link with a precursor to mental health conditions. Not being able to hug, wash hands and all those sort of things are really important. And we perhaps need a lot more research in that area. I mean, the other thing that did strike me, I know we have to be quick here, but I can't remember, Levy suggested that alcohol levels have gone down and that has caused problems in Nigeria. Well, in the UK, alcohol levels have gone up enormously and people are using that as a coping strategy, and it's a maladaptive coping strategy. And in the past 12 months, death rates from alcohol have risen enormously. So it is interesting that there are these country differences, but we need to have, it mentioned in the paper about special interventions need to be implemented, and there might be horses for courses here, but one way we need to go down this is really to look at, in my humble opinion, is to look at families and introducing opportunities for social life to continue. Thank you.
Okay, thank you, Rosanna. So in regards to in mental health, Dr. Helaluddin, you've been working this area long time ago, and you've been watching and you've been experiencing this kind of scenarios. I mean, in Bangladesh in a long time from your experience, and because we shared our research papers, and I hope you already gone through this paper. So based on the research findings presented today, so how do you think about this issue currently existing in Bangladesh? Thank you.
Thank you, Dr. Abir. Actually, at first, I want to congratulate all the researchers and all the contributors of this paper. It's a very well documented the mental health scenario during the pandemic situations in Bangladesh. And I want to just compare 2 or 3 things with this paper. That is, in 2018, in Bangladesh has a national survey on the mental health, and that survey we found that the 6.7% of the adult population have the depressive disorder, and almost 5% of the adult population have the anxiety disorders, and almost 1.5% have the major psychosis. In the contrast with that situation in the 2018, in this pandemic situation, we found that we found that there is a high rise of depression and anxiety. It's more fourfold rise of the depression and anxiety symptoms among the adult population. And it's the very crucial moment for the world, not only for the Bangladesh. The mental health scenario is all the Western world and the Eastern parts are almost similar during this pandemic situations, for the quarantine, new social measurements and others issues, the deaths, the post-trauma and others issues. So I think this is a very time demanding research, and the one finding is very much important to me, that in this scale here use the DAS-21. Here the depression is we found that the depression is the almost 15% is the severe depression we found here, 15% populations. And against these depressive features, we found that almost 59% of the anxiety with the person participate in the depression, the severe level of the anxiety among the 59 of the populations. That is very interesting characteristics, and we need some further. There are very good researchers, Mr. Polash Bonik, also Polash Boshak also here. He analyzes all the data. I think there are some overlapping of the anxiety features on the depressive features. So we can try to separate some things that just isolated depressions or the isolated anxiety. Then we can use in this data the several other scales other than the DAS, the depression specific scale or the anxiety specific scale. Then we can just separate that the anxiety symptoms over the person with the depression. That is from my side the observation. Otherwise, it's very nicely written, very well organized, and it will be give us some food for thought for our next broad-based survey on the mental health during the COVID situations and during the any other case of the mental health emergency like this pandemic and others. So I again thank you to all the authors, all the researchers and the contributors, and give my thanks, and I'm grateful that you can for inviting me in this auspicious session. Thank you, Dr. Abir and others. Thank you.
Okay, Dr. Helal, Associate Professor at the Mental Health Institute. So I got a question to ask you, because you've been working in this area long time, because especially you are observing Bangladesh, since the pandemic starts last year. So how do we give people the opportunity for social life to continue?
Thank you. Actually, if we go through the Sustainable Development Goal Agenda, SDG, there are goal 3, that is the ensure the well-being of the populations of a country. The well-being consists of 2 types of well-being. One is the physical well-being. Most of the doctors and clinicians are saying about the physical well-being, but there is a very good component, another component of well-being, that is the mental well-being. So we have to ensure the mental well-being, and this research also gives some lights that the mental well-being is not good during the pandemic situations. And when the severe depression is 15%, there are every chance of high rise of the suicidal rate of a country. So our mental well-being can be compromised during these pandemic situations. For that reasons, not in the Bangladesh, the globally we have not a very adequate number of mental health experts. Globally, the resource is very limited. The number of the mental health experts is short. The number of the psychiatrists or psychologists, both are very shorted. So we have to develop some social measure, the social intervention, the community-based social intervention to ensure the mental well-being. Not depends on the psychiatrists. We should not depend on the psychologists. We should depend on the community measure, the community involvement. And there are some, this research can give us some new indications to develop the community-based intervention module, very short community-based intervention module, not written in the textbook, not written from the psychology book, not from the psychiatry book, not from the other, develop the guideline. We have to develop our own culture-based, community-based, community involved short intervention to provide the mental well-being. That is my concern, and we have some research like this. This is a very good research, and from this research we can develop our own strategy. How can we develop our community involved culture-based short intervention model? And I think you and your research team will do the best on this concern. Thank you.
Okay, Dr. Hilal, thank you very much. I move to Dr. Abul Hassan Milton. So how do you interpret the current situation from your ongoing research? Thank you.
No, thank you, Tanvir. It's an honor to be here, and all the participants here. We initially conducted a very small study. Sample size was around 500, and that was sort of a pilot study. And then we jumped into this large study. The sample size of this study is really strong. It's very large, and that's one of the strengths. And there are similarities between the findings of that initial study and this large study. So the study findings is that reflects the situation of Bangladesh, especially during the initial days of pandemic. And I am not only a researcher, I am also an activist. I lead a doctors group of Bangladesh, consists of almost 49,000 doctors. And we ran a telemedicine program since last March 26 for almost 6 months. And the request is to receive from various people that they also need some sorts of psychological support or counseling support. So that's a felt need we realized from the community of Bangladesh. But when we are doing research, we are identifying the problem. When we are talking about the solution, that has always been a challenge in a country such as Bangladesh, where even access to healthcare sometimes become difficult during these pandemics. And there are ups and downs in the incidence of COVID-19. It has never been too bad or too good. So we are in a situation where we are still struggling, we are facing challenges. And as Dr. Hilaluddin Ahmed mentioned, still psychological health is still not a priority in Bangladesh. So it is putting a lot of pressure on Bangladeshi population. And I request Dr. Hilal, they are leading the Psychiatrists Association of Bangladesh, and they are maintaining a good relation with the government. So whether you can initiate any sorts of tele-counseling support, because that has become an issue. Even if I consider myself, I have started feeling bad because this is 15th month I haven't visited Bangladesh. This is I have always been there 3 or 4 times in a year. So I have started feeling uncomfortable. I don't want to label as depression or anything, but this is a reality, and these uncertainties, and it's not only the case of Bangladesh. These similar studies are conducted in other parts of the world, especially China conducted 2 or 3 studies. Even in Europe, all the studies had similar findings. So it's related to the pandemic. So the first thing is we need to remove the cause of this depression or added psychological burden. And that is the root cause is this pandemic, COVID-19. So we have to face this. And additionally, it would be fantastic if Bangladesh can adopt some of the tele-counseling support in some form, we are facing this problem. We are trying to address this at individual level, but nothing to claim that we are doing a great things. We have a psychologist in our team as well, and but our psychiatrist, our manpower is also not sufficient to deal with this problem. But I may urge the government of Bangladesh and the psychiatrists to bring this issue forward, because it's very difficult to bring issues forward in Bangladesh, because there are a lot of criticism of research by the Bangladesh bureaucracy. When you do a research and disseminate the findings, immediately the bureaucracy will stand and say, no, you are exaggerating the situation. This is a peculiar situation we face in the developing countries. So in this complicated situation, we all know there is a problem. We all know there is an additional burden, psychological burden imposed, attributed by this pandemic. But when we talk of solution, we don't have many things to offer. There we need to work. And that's why I always see myself as an activist first and then as an academic or researcher, because unless we can address the issue, we can solve the problem. Sometimes I feel guilty of conducting research and bringing a problem onto the surface. So let's hope for the best. Bangladesh is mostly by chance, and it's their good luck that they have not been affected very severely, although their neighboring country, India, is currently facing a turmoil. Bangladesh has identified Indian variant of COVID-19. Still, it's a surprise that still it's controlled. They had a spike very recently, but immediately with the imposing of lockdown, it was brought down, and now we are all observing, watching the situation, see what happens. But I will be very happy, in addition to healthcare services, if we can offer any sorts of counseling support. Thank you very much.
Thank you very much, Dr. Abul Hassan Milton, for your valuable discussion. So actually, before I move to ending this session, so I would one of our colleague asked me to ask Rosanna to answer this question. Rosanna, England is doing very well, compared to the last year, and they are trying to get all the people in England get vaccinated, and they are trying to finish it as quick as possible. So after vaccination, do you think any kind of mental health issue may come up in the society?
That's a big question. My own impressions, and people listening, is that there is more an optimism in society that vaccination is helping. We are ahead of the world in all sorts of ways, but there is still an uncertainty to how far the vaccine is going to provide long-term protection. And I think that is the message. So even though I've been vaccinated and I'm having my second one next week, and the vast majority of the adult population over 40 have had one or two, and we're getting down to 30s, there is now a push to have a booster dose for all the I think it's for over 50s, it might be over 60s in the autumn, like the flu vaccine, while we're in this interim period of seeing how much protection the vaccine does actually give. So in the meantime, although there is this optimism, there's still social distancing measures in place. There's still an urgency to wear masks in certain places, but the cinemas are opening soon, so you could go in. There's mixing indoors starts next week, hopefully, but still carrying out these measures. And if anything, I could say it's probably improved the hygiene generally of the population in terms of hand washing, even though you might think that we're quite a clean nation normally, it has become clear that these measures are still required for general health. I mean, one thing that might not have come clear to you is that the flu rates, because we do have influenza going on at the side of COVID in the country at the moment, and deaths from flu rates have overtaken COVID rates now. So there's been a kind of, we can't take our eye off the ball of everything else that is important to good health. So to come back to the mental health part of it, I mean, we have got a situation where people are probably drinking too much to cope. We are at the situation of people are worried about going back to work in some ways, and there is a call to go back to work. There is worries about what's going to happen economically when the furlough system ends. There are worries in terms of us being what's called a nation of shopkeepers, but everything's gone online, and what's going to happen on the high streets because shops have closed. So all these, even when we think we've got a handle on COVID, it's leaving its long-term mark on society in some way. And this is what it's just trying to understand it. And we're probably going to be learning on the job in some ways, and what comes out in the wash. Suicide rates haven't gone up. There have been some figures about that. But that certainly does not mean to say that there's not a lot of, well, still quite high level mental health issues in the society as well. Have I answered your question, or have I gone off on one?
Okay, Rosanna, I got a very one supplementary question. What is the conditions among the young generations in the UK?
Right, right. Well, with the students, I've got a lot of, I can say that, and this has been reiterated nationally, at the moment we've got 86% of our students who have returned to their place of study, whether it's on campus or wherever. Now this could be as well because whilst they want to get back, it's a social thing. They're fed up of being stuck in their parents' house in their bedroom studying.
That's true. Okay.
That's it. The schools have gone back. They are wearing masks, and there is this debate that's going on in the moment. Once they're in the classroom and sit down, they're facing the front, do they need to wear a mask or not? And the teaching unions are arguing that yes, they do. But again, this lack of evidence really. But we do know, and we've seen it ourselves, that when they come out to play and go home, they're doing what normal children do in some kind of way, in that limited opportunity that they've got. The young people under 30 who are perhaps in that low level of their careers working, they're making decisions on whether to have the AstraZeneca vaccine because it's been declared unsafe for that age group. And whilst we've got plenty of AstraZeneca vaccine, the other vaccines, and there's scare stories going around about the Moderna, and I know this from my son who's 26, and had a conversation with him about, and his friends, about whether they're going to be vaccinated or not because of all these messages. But if they can get the Pfizer vaccine in quantities which seem to be short, I'm sure that will go ahead. So yeah, and it is probably that 20 to 30-year-old group that are most vulnerable in some kind of way, because a lot of them have been wanting to start a job, wanting to move up, wanting to buy a house, and those things that has been normal hasn't been possible. And no social life, as I mentioned before, and now this uncertainty of whether the vaccine is actually going to kill them rather than cure them. But I mean, there's this, because of the blood clot issue with, or whether it is an issue, but again, we need more data. So to come back to the main point you were saying, it probably is the young people, and this is where we do need more data, really, who are most vulnerable to mental health impact in the long term.
Okay, thank you. Actually, yeah, I agree with you. At the time of publishing this paper with my other colleagues, we noticed very crucial, because there are very limited data from adolescents and children on mental health during the pandemic. The government or the agencies, they are not they are not giving emphasis on collecting the data. Actually, we have to suffer in the long run if we are not analyzed properly. Anyway, thank you very much for your time. And I would like to Mr. Adnan Rahman, Senior Lecturer, College of Business Administration, for his vote of thanks. Thank you.
I, on behalf of the CBA IUBAT, extend a very hearty vote of thanks to the honorable delegates who blessed us with their presence and took out valuable time of your busy schedule. Also, I'd like to extend a special thanks to Dr. Tanvir, Associate Professor, CBA IUBAT, for inspiring us. I especially like Mr. Dawan Muhammad Noor Yazdani's speech, where he really mentioned about the mental health issues happening in Bangladesh during this devastating pandemic. The way he explained the topic is really excellent. I also wish to express my gratitude to our Honorable Dean, Professor Dr. Khair Jahan Sogra, for providing encouragement and support, and also giving us an opportunity to organize this event, as no program can become successful with a single person. So I extend my big thanks to all the authors of the paper presented in this webinar for their support. The name of those authors of this paper, respected authors, Dr. Tanvir Abir, Associate Professor, CBA, IUBAT, Professor Dr. Major Nazmul Ahsan Kalimullah, BNCCO, Vice Chancellor, Begum Rokeya University, Rangpur, Dr. Uchelsu Levi Osagu, Postdoctoral Research Fellow, School of Medicine, Western Sydney University, Australia, Mr. Taha Hussain, Lecturer, Department of Gender and Development Studies, Begum Rokeya University, Rangpur, Mr. Fiona Christopher Gosson, Department of Physiatry, College of Health Science, University of Jos, Nigeria, Mr. Paulas Basak, School of Environment and Life Science, University of Newcastle, Australia, myself, MD Adnan Rahman, Senior Lecturer, CBA IUBAT, Mr. Abdullah Al Mamun, Associate Professor, Dr. Abdullah Al Mamun, Associate Professor, Faculty of Business and Management, UCSI University, Malaysia, Dr. P. Yuktamarani Paramirupan, Faculty of Entrepreneurship and Business, University, Malaysia, Kelantan, MD Yusuf Hussain Khan, BATHM, Assistant Professor, IUBAT, Dr. Abul Hasnat Milton, Research International, Dhaka, and Epidemiology Resource Center, Newcastle University, Australia. It's NSW, Australia. And Dr. Kingsley E. Agho, Associate Professor, School of Health Science, Western Sydney University, Australia. And our special guest, Dr. Helaluddin Ahmed, MBBS MD, Associate Professor, National Institute of Mental Health, Dhaka, and Dr. Rosanna Cousins, Assistant Head and Associate Professor of Health Psychology, Liverpool Hope University, Liverpool, UK. Thank you everyone once again for making this event successful with your contribution. Thank you all. Stay safe.
Thank you, MD Adnan Rahman. Mr. Taha Hussain, could you please give your thought or any suggestions or?
At the beginning of my speech, I want to express my heartfelt gratitude to Honorable Vice Chancellor of Begum Rokeya University, who has given me this opportunity to work in his team, leading by Dr. Tanvir Abir. I want to congratulate all authors who have contributed to publish a core research paper in the field of mental health amid this COVID-19 situation. I believe and hope that in near future, this team will work together and continue to produce such tremendous research work in this field. Again, thank you all. Thank you, Dr. Tanvir Abir, for inviting me here. Advance greeting of a holy Eid Mubarak to all. Thank you.
Okay, thank you very much. Thank you very much, and Eid Mubarak to you. So, Professor Khair Jahan Sogra, the Dean, School of College of Business Administration. So, do you have anything to say?
Ma'am is not here, sir.
Okay, so on behalf of the Dean, Madam, on behalf of College of Business Administration, so I conclude this session I'm finishing this session right now. Thank you very much. Thanks for coming, and hopefully we will get you again if we any research program we can supervise and we can publish in near future. Thank you very much.